Hi, my name is Brooke Combs, and I'm going to be presenting about cerebral palsy. Some of the content that's going to be in my slides is what is cerebral palsy, what are the symptoms, what are the different causes of cerebral palsy, what is the importance of being educated on cerebral palsy, management and treatment, how we can help students in the classroom understand, and also the students who have cerebral palsy feel comfortable and want to participate in the classroom, and then the benefits of general classroom exposure, and then the resources page. What is cerebral palsy? Cerebral palsy is a group of conditions that affect movement and posture along with many other things, and it's caused by the damage that occurs to the developing brain, usually before birth. And then here I have an image of the different parts of the brain that it can affect, and then also how that affects the different parts of the body, and it shows many different areas of the body that it's affected along with the areas of the brain that are affected. Some of the symptoms of cerebral palsy: in some individuals, it affects the entire body, while in others, it only affects specific parts of the body, but it also can affect the movement, the coordination, speech, eating, and development. And this is different for all students, all patients, anyone who has cerebral palsy. It's going to be different, and the symptoms are going to be different, and how you handle those symptoms is going to be different. It also comes along with cognitive impairment, slurred speech, lack of muscle control, and then lack of bowel movement, which all of these things is obviously going to affect the student in the classroom, even at home, and making sure that they have the help that they need during those times is very important. What are the causes? There's preterm birth, there's congenital malformations, infections in the central nervous system, strokes that affect the developing brain, infections, and then also the breathing that happens whenever they are not born yet, so in the womb and stuff like that. There's not any main causes for it, there's just a bunch of different ones. Being educated on cerebral palsy is super important for teachers, for students, for families, anything that you can think of, because when a student with cerebral palsy is in the classroom, you want to make sure that no matter what the age group is that they feel welcome, and that the students in the classroom are making that student feel welcome, because everybody wants to learn, everybody wants to feel comfortable, everybody wants to feel safe, and being educated on different disabilities like cerebral palsy can help students understand that it's okay to be different, and that we should include everybody and help everybody. And so therefore, cerebral palsy awareness fosters understanding, advocacy, and support, dispelling myths, encouraging early treatment, and building connections to improve lives and opportunities for those affected. Because having a safe environment to learn in will allow the student with cerebral palsy to feel safe, but also to venture out and want to do new things that they never thought that they could do. Management and treatment for it: you can take medications, there's different surgeries that can happen, physical and occupational therapy, which is a really big one for cerebral palsy students or patients that need to learn how to walk, need to learn how to eat, need to get help writing, with speech, all of those different things. Speech therapy, and then mental health therapy, because even though cerebral palsy is a big physical thing that you can see, and also that the student and patient has to deal with, but also the people around them are going to probably make them feel unsafe, uncomfortable, and that can really affect your mental health. And then also just struggling in school, struggling to eat, struggling at home, and seeing that all the other kids are normal or different or don't have the problems that this student has, then it can make you also feel a different type of way mentally, and that can just affect so many different things. And then also social work and educational support, so making sure that they are supported in the classroom, that they have certain accommodations in the classroom like special seating, special bathrooms, making sure that the students are educated so that the cerebral palsy student feels like they're welcome in the classroom, and that if they need help, that they can ask for help with anything. And all of those are just really important. How can we help students in the classroom? We can create an inclusive learning environment to feel heard and understood, so that like maybe making sure that they do have somebody in the classroom to help them, or they feel like they can sit closer to the board with other students and not just them right in front of the board. So that leads to my next one of variety of seating arrangements and boards and restrooms. Maybe having tables that are open and not like the desk that you see in most classrooms, so that wheelchairs can fit under the desk. Or maybe if the student needs to stand, then they're able to do that without being in the back of the classroom. So maybe having higher tables that even other students can sit at with them, so that they're not alone. And then having boards like either all over the room, or having a big board that all of the students can see, and that the students don't have to sit right in front of the classroom and feel like they're blocking other people, or they're not the only ones that need the board that big. Restrooms, that's a big one, making sure that the restroom stalls are wide enough, or that maybe there's somebody, a teacher or principal or a social worker, who can help them in the restroom, or even a medical professional who can help them in the restroom, getting in and out, and just other things like that, especially with the bowel movement issues. Allowing different type of transitions for assignments and tasks, so just maybe making sure that they have a long period of time for assignments, and they can get extra help with those assignments, possibly getting like having a teacher at their desk to help them, or even just having maybe part of recess to work on their homework if they want to, or if they want to go outside with the other students, or if they want to play with the other students, that they have the time to do that. Offering different materials or assistance with different tools, and then having options for voice to text or technology, or even the teacher's assistance. Having the voice to text is super important, because a lot of cerebral palsy patients and students don't know, or can't write, and sometimes they can't speak, and so having options of things to speak for them, or having the voice to text that can help them say something and then it writes it for them, because maybe they can't use a pencil and stuff like that. The benefits of general exposure in the classroom: it can increase social relationships with the cerebral palsy students. So like being in the classroom and not just being at home or homeschooled, that can help with the social relationships and getting to know new people, and knowing that like they're welcome in all areas and not just at home. Pure role models and social behaviors, just having someone like a best friend in a classroom who helps them feel like they fit in and just includes them in different things. Increased achievement of goals: if they're in a classroom with other students, they feel more encouraged to do their assignments, or they're more interested in what they're doing, so therefore they're achieving more goals. And even outside of school, like after they graduate, maybe they already had the social environment, so they know how to work with other people, and they can get like maybe a job somewhere. Create greater access to curriculum. Sometimes whenever you're homeschooled, you don't learn all the things that you need to learn, and like especially the social relationships. So being in a classroom can increase different things that you're learning, and also just your social relationships. It can enhance your skills, so maybe getting the speech therapy in the class, or having access to the different technology can definitely help, because maybe you don't have that at home. And then there's different books in the classroom, which can help with many other things. Increased parent participation: having the parents know that their student is welcome, and that their kid is welcome in the classroom, maybe will help the parents be like more understanding of other students, but also know that their kid is welcome in the classroom, and that they are learning, and that they feel safe, and that they feel comfortable. And then here are my references, and then also the link to my accommodation demonstration PowerPoints, the 2 that we have. Thank you. Here are my accommodation videos. For my first accommodation, I have a student with cerebral palsy kind of sitting off by himself, and then all the other students sitting under a desk next to each other or standing. And students with cerebral palsy may have the use of wheelchairs or walkers, so they need clear, open, accessible paths and adjustable desks. So my accommodation that I came up with is to have desks that are open at the bottom so that they can allow wheelchairs to go under, and also allow other students to sit at the desk so that they don't feel left out and that they can all learn together. And then for my second accommodation, I have students who are enjoying taking their notes and can keep up very well and seem to be happy. And then I have the cerebral palsy student who looks like he's struggling with his notes, seems to be frustrated. And students with cerebral palsy may have slower fine motor skills, which can make it harder and frustrating to take notes. So the accommodation that I have is to have a teacher with the student with the cerebral palsy and maybe helping them write, or if they can't write, having the speech to text technology, and that can make it more enjoyable for the student to learn, but also they are able to pay attention in class and not worry about if they're falling behind or if their handwriting's good, or not worry about what other students are writing down and just focus on being able to get theirs done and enjoying what they're learning in class. And then I also have my cerebral palsy handout that has everything about cerebral palsy and all of the links on it as well.